As a general surgeon, I treat cancer patients daily. Some days I get to tell them their cancer is gone. Other days I must tell them it's reoccurred. But my connection with cancer became much more closer once I was diagnosed with breast cancer at the age of 37. In addition, and what was most devastating to me, was that my sister was diagnosed with a breast cancer a few months later that was initially missed on screening mammogram because of her dense breast tissue. Which brings me to why I am here today. If you are a dense breast patient like me and my sister, you might find yourself worrying every year about a breast screening experience that can be painful, uncertain, and anxiety-producing. Existing options are very uncomfortable and have flaws. It's very clear that a problem exists, and it has for a long time. There has to be a better solution. Every year for the last 10 years, more than 40,000 women have died from breast cancer. Why? We need to find cancers earlier. One clear problem is that many patients don't like the experience of early detection screening, so they simply avoid it. Patients hate painful breast compression, and patients fear radiation exposure. So many patients that should get screened don't even show up. But there's another very specific problem with patients with dense breasts like me. Mammography misses up to 40% of cancers in dense breasts. Wow. And 40% of women have dense breasts in the US. This makes this a very huge issue. Why do we need to talk about breast density? Because it really matters. Having dense breasts increases a woman's risk of developing breast cancer 4 to 6-fold. That's a higher risk than having a first-degree relative with breast cancer. 40% of cancers are missed on mammography in women with extremely dense breasts, and 30% are missed in women with heterogeneously dense breasts. Why is finding cancers so difficult in patients with dense breast tissue for the traditional mammography gold standard? Well, because on mammography, dense breast tissue is enhanced as a white color. And so are cancers. Because on mammography, finding cancers in dense tissue can be like trying to find a snowball in a snowstorm. That's understandably hard. Mammography and other current options have done their very best. But we clearly need a new technology for patients with dense breast tissue. It's also important to recognize that patients with dense breasts need special guidance to consider additional screening options. That seems obvious, but don't take my word for it. A majority of states and the federal government agree and have implemented or are in the act of implementing breast density notification laws to make sure patients are informed of their breast density so they can actively pursue additional options. But laws simply aren't enough. Why? The language in these notification letters is vague, and people are not sure what to do or what to think when they get these notification letters. What does this mean? Should I be concerned? Do I need more imaging? What kind? Will insurance even cover the exam? Laws simply are not enough, especially when the technology options available fall short for patients with dense breasts. We need a technology that sees more cancers in dense breasts and delivers an experience that's more comfortable. SoftView is the answer. What is SoftView? SoftView is a 3D whole breast ultrasound tomography system that uses triple acoustic technology and a unique ring transducer to not only detect masses, but also help characterize them in a single 2 to 3 minute scan per breast. In fact, SoftView in combination with mammography increases cancer detection in women with dense breasts by 20%, increases specificity by 8%, and it's covered by existing insurance codes. Plus, SoftView can be performed on the same day as a woman's mammogram and does not require a specific license for operators, saving time, saving money, and increasing the likelihood of catching cancer earlier. The data is in, and SoftView is the solution to the dense breast screening challenge. I invite you to learn more about SoftView at delphinusmt.com to see how you can adopt a solution that will solve the dense breast screening challenge for your patients. And if your patients have questions about their overall breast cancer risk, please have them visit operationbreastdensity.org.